To Your Health, where we talk to local health leaders to help you feel better, live better, and be better.
Hey everybody, and welcome to Your Health. Today's topic, osteoarthritis. And I'm joined by Dr. Kevin Campbell from OSI. Dr. Campbell, good to have you.
Good to be here.
Well, I wanted to have you on because osteoarthritis is something that really afflicts a lot of people, and maybe we should just set the stage of what's happening if you have that.
Yeah, osteoarthritis is wearing thin of the cartilage pad between our joints. So that can be the hip, the knee, but when it wears thin, it starts to create pain, and that's what brings people to the office.
Well, let's think about symptoms. Is it something where you get to be my age, you're going to have it anyway? Is it overuse? What happens and how does it feel?
Yeah, it's a great question. It can happen for a number of reasons. Ultimately, what it is wearing thin of the cartilage pad, and then that creates pain, swelling, stiffness, and patients will notice it when they're having difficulty doing the things they like to do, whether that's bike riding, exercising, just simple things like getting in and out of the car. Those are things that my patients will complain of when they come into the office.
You don't need to be a marathon runner to have this happen to you. So if you're starting to feel that, what are the basic treatment options?
Yeah, most people will start to modify their activities, identify the things that are causing them trouble, sort of avoid them. But when it starts to affect them enough, they start looking for treatments. Oftentimes, first things are things like Tylenol, anti-inflammatories like ibuprofen and Aleve. Those will work for some time, but then ultimately they're looking for something more permanent, and then they'll come into the office for evaluation.
And that's kind of where you come in, one of the leaders there. So when it's time for surgery, the hip or the knee, let's walk them through that process.
Yeah, so surgical options for arthritis of the hip and knee include stuff like anterior-based hip replacement or knee replacement. Those are surgeries where you cut away the arthritis and then cap the bones with a smooth gliding surface that takes away the pain and improves the motion.
Because you guys are state-of-the-art, how long from surgery to go home?
Yeah, most patients are coming in the morning, having surgery, and going home the same day. So they're starting their recovery at home, which patients really enjoy. It's a more safe, a more comfortable environment for them. We walk patients through the recovery, and then most patients are doing most things 6 weeks after surgery.
And I suppose most of your patients are probably getting back to most regular activities, right?
Yeah. I want all my patients to get back to the activities they were doing before surgery, and then even explore with some new ones that may have been holding them back when they had the arthritic pain.
All right, Dr. Kevin Campbell, OSI, thanks so much for being here, and we want to thank you for watching To Your Health.